Hello, I'm Terry Lockhead, and I'm here with Richard Fiesta, the Director of Government Affairs at the 4 million member Alliance for Retired Americans. The Alliance for Retired Americans is a nonprofit organization based in Washington. It's a grassroots voice for retirees and seniors, and it has 32 chapters across the nation in each of 32 states. Today, Richard Fiesta, who has spent his entire career working on retirement issues in Congress and the Department of Labor, is going to update us on some changes in Medicare. And some of these changes have been enacted through the Affordable Care Act. They're positive changes, but there have also been some radical changes proposed, and we're going to talk about those too. So, Rich, what's the good news? What did the Affordable Care Act bring us retirees?
Well, the Affordable Care Act did a number of very good things for people on Medicare, and as well, it did some good things for the program itself. Through some cost cutting and tightening of the belt, so to speak, the Medicare Trust Fund, which originally was supposed to have more money going out than coming in the year 2017, the trust fund solvency has been extended another 7 years to 2024. So that's obviously a very good and positive thing for the program. For beneficiaries, a number of very good concrete beneficiary improvements have been made as well. Probably the best one is that screenings for people on Medicare, and now there are 42 million Americans on Medicare. In our country is about 310 million, so that's a lot of folks. Screenings for diabetes, cancer screenings for mammographies, prostate, colonoscopies, and the like, they are all now free to the beneficiary, so there's no more copay and there's no more deductible for that. Very good for health improvement, very good for preventive care that not only will improve quality of life for a lot of people, it'll also help the financial situation of the Medicare system as well. So this is something that started last year in 2010, or 2 years ago, 2011 now. So more and more people are learning about these improvements and are taking advantage of them.
And what about prescription drug benefit?
Well, as you know, Medicare Part D was enacted in 2003 for prescription drug coverage. And Part D has a system where if a beneficiary has a lot of drug costs, they may fall into what's known as this donut hole after spending $2,000+ that they will unfortunately have to still send money to a private insurance company every month, but don't get any benefits from it. The Affordable Care Act closes that donut hole over time. In 2010, people who fell into it got a $250 check. Starting in 2011 and going forward, people now who are in the donut hole only pay 50% of their costs for brand name drugs, and 14% discounts are in for generic drugs. So they're saving money. And so we now have a whole year under our belt, and the average savings is roughly $600 per person who falls into the donut hole. So that's been a very positive change as well because of the Affordable Care Act.
Great. Well, so tell us what is the Ryan budget and what would its impact be on Medicare?
Now, the Ryan budget is named for a Wisconsin congressman named Paul Ryan, who last year in 2011 became chair of the House Budget Committee. And his budget, which passed the U.S. House in late March of this year, would do some very radical changes to the Medicare program. First among them is it would actually raise the Medicare eligibility age, which has been 65 since the program began in 1965, to 67. So people who are 65 and 66 no longer would be eligible for Medicare, and they'd somehow have to find insurance on their own until reaching the age of 67. And as we all know, older people, especially those above 55, find it very, very difficult to find insurance in the first place. So we think that is a very bad threat to Medicare's beneficiaries. To the program itself, the Ryan budget would actually change it into a voucher system. Medicare no longer would be the one-stop shop it's always been, and private insurance companies would then enter the market every year and beneficiaries would have to sort of pick and choose amongst plans. The Medicare Trust Fund would then send a payment to each of these insurance companies based on the number of people who sign up. But the way Ryan wrote the plan is what's sent from the trust fund to the insurance companies over time will be basically a fixed amount. At least it'll be an amount that will not be keeping up with healthcare inflation. So that gap between the costs and what the trust fund is sending to the insurance company is now going to have to be borne by the Medicare beneficiary. And independent studies have shown that early on in this program, if it becomes law, that the beneficiaries will have to pay about $1,200 more a year, and 5, 6, 10 years into the program, they'll be paying out of pocket about $5,000 or $6,000 a year. So it's a real shifting of costs to the beneficiaries. You know, we like to say it's a one-stop shop program we have now. Let's improve it and keep it that way.
Wow. Well, what other impacts would the Ryan budget have on our retirement benefits?
The Ryan budget also has a kicker in it on the Social Security system. If federal spending reaches certain amounts under the Ryan plan, under a formula he's put in, then all federal spending and benefits would be automatically cut across the board. And he doesn't have an exception for Social Security. So under his plan, it's sort of a fast track to Social Security cuts. Which we find very, very troubling. The average Social Security beneficiary is about $14,000 a year. That's not a lot of money. So when you start looking at programs that would have automatic cuts to $14,000 average benefits, we at the Alliance for Retired Americans find that very troubling and oppose these types of programs.
So fast track, does that mean that the regular legislative process would be used or circumvented, or what does that mean?
Yeah, it would be circumvented, that automatic procedures would go in the rules in Congress. There'd be very limited, if any, opportunity for amendment. So it would just be like you know, setting a clock and letting it run on, and the result would be Social Security cuts in the case of that program.
Wow, very sobering. Well, thank you for joining us today. This has been Richard Fiesta, who's the Director of Government Affairs with the nonprofit Alliance for Retired Americans, a 4 million member voice for retirees and seniors in the United States. Thank you for joining us.